Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Blood is the lifeline of our body, carrying oxygen, nutrients and hope with every beat of the heart. It keeps us moving, laughing and living. But when cancer strikes the blood, it silently disrupts this flow of life. It also develops silently, but with awareness, early detection and timely treatment, lives can be saved. Today in Wellness Watch, we shine light on blood cancer and its prevention. I'm Preeti Kaur. Cancer is a word humanity has learned to be cautioned around, and rightly so. With around 10 million deaths per year, according to the World Health Organization and various others, this disease is a leading human killer. Of all the cancer types, blood cancer is one of the top contributors in the death toll, and yet the awareness and knowledge around it is minimal. So here is a deeper dive into the anomaly called blood cancer. Let's take a look at Rupak Kumar Jha's report.
Although the term blood cancer is not unheard of, the wide dimension of the malignancy is not accurately understood. When doctors talk about blood cancer, they mean cancers that can start in the blood itself, in the bone marrow, or in the lymphatic system of the human body. Blood cancer isn't just one disease. It's an umbrella for several conditions where abnormal cells crowd out healthy ones, disrupting the system that carries oxygen, fights infection, and helps the body to heal. Also known as hematological cancer, blood cancer is of three broad kinds. Firstly, there's leukemia, which is caused by the rapid production of abnormal blood cells in the bone marrow. In simple terms, the bone marrow fills up the faulty cells, limiting its ability to produce red blood cells and the platelets. Then there is lymphoma that begins in the lymph nodes. Abnormal white blood cells can become lymphoma cells that grow unchecked in the lymph nodes and weaken the immune system. And the third is myeloma that damages plasma cells and leaves the body open to more infections. Symptoms alone rarely point straight to blood cancers, but the warning lights are easy to list. Persistent fatigue and weakness, frequent fevers and infections, bleeding or bruising without clear reason, swollen, painless lymph nodes, especially in the neck or armpits, night sweats, bone pain and breathlessness. The first signs are often missed. A person may feel tired for weeks or keep getting infections. Some lose weight without trying. Others complain of night sweats, fevers that come and go, or lumps in areas like the neck and underarms. It is due to this wide-ranging spectrum of symptoms that blood cancer is so difficult to catch in the early phase. Families sometimes think it's just weakness or stress, but for the doctors, these are the red flags. In India, the numbers are worrying. More than 1.2 lakh new cases are reported every year. Sadly, over 70,000 people die of blood cancer. Among children, leukemia is one of the most common cancers, about 1 in 3 childhood cancer cases. Globally, the World Health Organization also lists blood cancers among the major causes of cancer deaths. But here's where things have changed. Treatment is not what it used to be. As science makes new strides, doctors now have many options. These include chemotherapy, radiation, targeted medicines, newer immunotherapy drugs, and stem cell transplants. These approaches, often in combination, are helping the patients live longer and with better quality of life. Avoid smoking and drinking alcohol, eat balanced and healthy food, stay active through exercise or yoga, and go for regular health checkups. As it is rightly said, prevention is better than cure. But since prevention isn't always enough and nature doesn't always play out in one's favor, spotting problems early might make a big difference.
September is Blood Cancer Awareness Month, a time to raise awareness about blood cancers like leukemia, lymphoma and myeloma, encourage early detection by understanding key symptoms and support patients and families and research as well. Despite accounting for almost 10% of the cancers diagnosed worldwide, blood cancers like leukemia, lymphoma and myeloma remain shrouded in confusion. Today in Wellness Watch, we look for these answers. What is blood cancer? What are the symptoms of blood cancer? How common is this type of cancer? Is blood cancer curable? And we will also discuss the medical advancements that are available in India. Blood cancer treatment in India includes chemotherapy, immunotherapy, targeted therapy and also bone marrow or stem cell transplants. Also, treatment plans are personalized based on cancer type, stage and patient condition. Up on your screens, we'll have some hospitals and institutes that particularly cater to this type of cancer. All India Institute of Medical Sciences, Delhi, Ram Manohar Lohia Hospital, Delhi, Tata Memorial Centre, Mumbai, Kidwai Memorial Institute of Oncology, Bengaluru. To help us understand blood cancer better, we are joined in by guests. We are joined in by Dr. Gauri Kapoor, Director, Pediatric Hematology and Oncology, Rajiv Gandhi Cancer Institute and Research Center. She is here with us in the studio. And virtually, Dr. Sachin Punathar, Professor, Medical Oncology, Hematological Cancers, Tata Memorial Centre, Mumbai, is joining us. Thank you both of you for joining us on Wellness Watch this afternoon. To begin with, Dr. Gauri, I would want you to explain to our viewers in very simple terms, what is blood cancer and what are its types?
So, Preeti, as we have just seen, blood cancer is a cancer of the blood cells. And amongst the blood cells, it's the white blood cells were present in the peripheral blood. It could be the bone marrow cells, and it also could be lymphatic tissues present in lymph nodes, in liver, in spleen. And the various types would be leukemias, lymphomas, and myelomas. And amongst the leukemias, also we have the acute lymphatic leukemias, the acute myeloid leukemias, the chronic myelocytic leukemia, the CLL, and amongst the Hodgkin's lymphoma and non-Hodgkin lymphoma, and then the multiple myeloma. So there is a range of diseases which are grouped as hematological or blood cancers.
All right, Dr. Sachin, what are the early symptoms that one should look for when you're talking of blood cancer, and also how commonly is blood cancer found? So I request you to please unmute your device.
Yeah, I am unmuted. I am
Yes.
not on mute. The early signs of blood cancer are very non-specific. Many of them are simple things like fatigue, weakness, tiredness, some swellings which appear in the neck or in the axilla or groins. Many of these symptoms are often mistaken to be because of low hemoglobin or because of stress or other things. And some of them are indeed sinister enough to be a red flag or a red sign for someone to pick up a blood cancer. Now, as far as commonness is concerned, blood cancers are common, although they are not as common as other cancers such as breast cancer or lung cancer and other head and neck cancers, but certainly they do make up about 8 to 10% of all cancers that are detected in humans.
All right, yes, please continue.
Yeah, there are different spectra of cancers seen in adults versus different in children. For example, in children, acute lymphoblastic leukemia is the most common, whereas in elderly patients, acute myeloid leukemia is the most common. And there can, as Dr. Gauri has already mentioned, there are a spectrum of cancers which can affect all ages of patients.
All right, Dr. Gauri, fatigue and the early symptoms do also point out are similar to those of having those of dearth of hemoglobin in the human body. When is it that a person should see a specialist with regard to the symptoms which he is observing when we talk of blood cancer?
So you're absolutely right, as Dr. Sachin also pointed out, these are non-specific symptoms, because when there is anemia or there is a less blood in the body, then person feels fatigue. So usually what we say is any symptoms, whether they are fatigue or there is prolonged fever or there are lymph nodes present in the body, but if there is no apparent cause for this, and these symptoms persist for 4 to 6 weeks, then definitely you need to see a doctor, and usually the doctor, other than doing a good physical examination, will do a simple complete blood count, a simple blood test. And the examination and this blood report would give your doctor a clue whether further investigations are required, or it is a pure and simple case of not eating properly and therefore the diet is not good and the hemoglobin is low, and maybe they need some tonics like iron or B12 or folic acid.
All right. Is blood cancer age or gender specific? One. And secondly, can it be inherited also?
Very, very important question. The first thing is, like Dr. Sachin also said, the age specific point in young children, or I will say in children and young adolescents, acute lymphoblastic leukemia is the most common cancer. And I will also say, of all the cancers which occur in children, 25 to 30% are blood cancers or acute leukemias. Amongst adults, it is 6 to 10%. Secondly, the ALL is the most common in young children, and important thing to remember is they present with symptoms within 2 to 4 weeks. Also, it is highly curable with modern treatment. Therefore, there is a huge amount of optimism associated with it. That means do not shy away from diagnosis, seek treatment, because your child can be cured. For adults, the leukemias are different. They are biologically different. They are more aggressive. They don't respond that well. But with today's treatments like immunotherapy, targeted therapy, their outcome is also improving. So there is an optimism here. Regarding sex also, there is a difference. Like the ALLs are more common in boys. Then we have things like response to treatment, which is another thing which tells the outcome. And then now with all the diagnostic molecular tests we have, we also know which leukemia will respond to which immunotherapy or to which targeted medicine. And with that, we can not only have a good outcome, but we can also reduce the toxic treatments and have good quality of life. So things, our scenario is improving.
All right, I'll take that forward to Dr. Sachin. Dr. Sachin, what are the different stages of blood cancer? And when we talk of the severity or the gravity of the situation, is it possible for a person to lead a normal life with blood cancer? Because the early symptoms are fatigue. The early symptoms show, a kind of dearth of hemoglobin. Having said that, when is it that, there is a need of caution for the patient to look into it seriously?
So let me first talk about the staging of blood cancers. So there are several cancers, like ordinary person would probably understand stage 1, stage 2, stage 3, stage 4. But unfortunately for blood cancers, because blood is there everywhere in the body, this rule does not apply. And there are different classification systems for blood cancers which give us the risk of the blood cancer. The risk whether it will be cured or whether it will not be cured. But cancers such as lymphoma do have a stage 1 to stage 4, and cancers like myeloma do have stage 1 to stage 3. Having said that, the more aggressive types of blood cancers such as acute lymphoblastic leukemia and acute myeloid leukemia do not have a stage, but they do have a risk score or a risk stratification system where they can be classified into different risk categories based on their likelihood to get cured. Discussing about the second question is, how can these patients lead a normal life? Yes, certainly there are several patients who get cured with these blood cancers and then can lead a normal life. Of course, there is a phase in which they do go through intensive therapy, about 6 months, 8 months, sometimes even longer than that. But after their therapies are over, many of these patients who are long-term survivors or long-term cured from those cancers, they do lead a normal life. In certain cancers such as chronic myeloid leukemia, the only medicine that requires is an oral tablet which is to be taken for a long duration of time. And these patients also essentially can live a normal life. Children can resume their studies, adults can resume their jobs, be it office work, be it more of field work or anything. But many patients who get cured with cancers are able to lead to a normal life. Barring their period in which they receive intensive chemotherapy, in which often it is advisable not to carry out very hard work, but otherwise in several situations, patients can lead a normal life.
All right. Are food, eating habits, or lifestyle choices somewhere linked to blood cancer, Dr. Sachin?
So the evidence that lifestyle or food habits or other things may lead to blood cancer is not as strong as it is for many other solid tumors such as lung cancer or head and neck cancer or breast cancer. And as Dr. Gauri rightly pointed out, there are some genetic factors which play a role in blood and related cancers. But having said that, as a general principle, it is always advisable for the people to lead a healthy lifestyle, to avoid excessive smoking or alcohol, and to have a normal and a healthy diet.
All right, Dr. Gauri, we've talked about the stages of blood cancer. We've talked about how people can lead, normal lives once they are cured. But then, is blood cancer completely curable? When we talk of the treatment of the blood cancer, can a person, after having completed the course once, how often are the chances of him getting the infection or getting the cancer back again?
So, Preeti, as we discussed, there is a spectrum of blood cancers. Blood cancer is not one disease. And when we look at the disease wise, we know that ALL is curable. 70 to 80% of patients can have a leukemia free long life with proper treatment. Same way, the cure rates differ from disease to disease. ALL is curable in 70 to 80%. AML is curable in 60%. But even within this, like Dr. Sachin said, we have got low risk of relapse, intermediate risk of relapse, or high risk of relapse. Right? So this is for the leukemia. CML, like Dr. Sachin said, we give the tablet and we give it for a long period of time, and patient is usually disease free. For lymphomas like non-Hodgkin's and Hodgkin's lymphoma, we know that stage 1, stage 2 cure rates are like 90%. Stage 3 perhaps 70%, and stage 4 would be about 40 to 50% cure rates. So also with myeloma. So for all of these conditions, there is a subset where cure and leukemia free, blood cancer free survival and life is possible, but only with appropriate treatment.
All right, Dr. Sachin, when we talk of the main types of blood cancer, or for that matter, help us understand what are the risk factors, when we talk of blood cancer, and can that be lowered?
Yeah, so as I did mention about the lifestyle and hereditary factors and other things there are certain risk factors for blood and related cancers. Many of these factors are hereditary or genetic, which possibly may not be amenable to modification. But there are other factors such as exposure to radiation and others which can be considered as modifiable and which can be minimized to an extent possible in order to reduce the risk of blood cancer. As a general principle, it would be advisable for people to follow a healthy lifestyle, a healthy diet, and a regular routine in order to avoid not just blood cancers but also other types of cancers. Also, as far as possible, addictions should certainly be avoided, whether it's alcohol, tobacco, smoking. All forms of addictions do harm the human body in some or the other way.
All right, Dr. Gauri, what is the research and development in the field of blood cancer? Where is India placed on the global page when we talk of medical advancements that have been made?
So I think these are very exciting times, because there is a lot of research happening in India as well as globally, and a lot of this is understanding better the biology of disease, because many new molecular techniques are now available to us, and with this we can identify why some patients do well and others relapse or don't respond. And by knowing the molecular abnormalities, we can even find drug targets. So in that way, in India and abroad, lot of excitement is happening, lot of discovery, new things are happening which are improving the outcome for the blood cancers. Now in India, we also have not only this, earlier these tests were not available in India. They had to be sent abroad, and the reports used to come many weeks later, in months later sometimes. And we had to, have the special courier to send it across, the Atlantic. But now everything is available in India. We have got all the molecular markers, next generation sequencing, PCRs, FISH, everything available here. Same way in terms of treatments, there is a lot of new immunotherapy and targeted drugs which are coming. And earlier these used to come to India many years after they were available in the advanced Western countries.
Right.
But now within few weeks or months, these drugs are available because of our pharma industry. They are available to patients in India here as well. So it has really improved the outcome for them.
I'll take that forward to Dr. Sachin. Dr. Sachin, would you add to it when we talk of the medical advancements? What have been the advancements that have been made in India, and also help us understand the treatment options that are available?
Yes, so as Dr. Gauri rightly said, the lot of advancements are happening in this field, not only in terms of diagnostics, but also in terms of prognostic classifications, detection of mutations, personalization of therapy, and treatments. In addition, India is uniquely positioned to, I would say there is a lot of research going on about phytochemicals, which are plant-derived products as an adjunct therapy in treatment of cancer. And there are a lot of initiatives by the government of India to promote research in the field of cancer. So I would say that India certainly is leading in not only in research, but also as well as far as treatment and its outcomes are concerned. And to a certain extent, the outcomes of cancer in India matches what is reported globally, thanks to whatever advancements are happening in this field, whatever research is happening in this field, not only because of government initiatives, but also because of other institutional initiatives and other priorities in the field of oncology.
All right, so for our viewers today, we are discussing blood cancer awareness, and we're joined in by doctors. We're joined in by Dr. Gauri Kapoor, and we're joined in by Dr. Sachin Punathar. And now we will have a quick rapid fire round for some myths to be cleared. I request both of you to give very crisp answers. Dr. Gauri, first to you, blood cancer, particularly leukemia, only affects children or the elderly. Is it true?
False.
All blood cancer patients need a bone marrow transplant, Dr. Sachin.
Not at all.
Avoiding sugar is essential to stop cancer cells from growing, Dr. Gauri.
Myth. This is not true.
Intake of vitamins and supplements can reduce the risk of cancer, Dr. Sachin.
Not robustly scientifically proven.
All blood cancer treatments are the same, Dr. Gauri.
This is not true. They depend on the disease and the stage.
A bone marrow examination, in fact, makes patients weaker, Dr. Sachin. Is it so?
No, absolutely no.
All right, with that, we'll end this discussion here. Thank you so much, Dr. Gauri and Dr. Sachin, for joining us and helping us understand blood cancer better. So after this wholesome discussion, we did understand that blood cancer can be frightening and stressful. When blood turns against the body, awareness becomes the weapon. Blood cancer may begin in silence, but with awareness, unity and courage, we can make the fight louder than the fear itself. Spot it early, fight it strong and spread hope. On that note, we'll end this discussion here. Thanks for watching Wellness Watch this afternoon. Bye-bye.